We've lost more than 412,000 Americans to COVID-19. That's more than all of the U.S. military casualties during World War II. So many homes, hearts, families with a huge hole now. How did it happen? Here's an NBC News timeline.
At this moment, we have 22 patients in the United States currently that have coronavirus. Unfortunately, one person passed away overnight. She was a wonderful woman, a medically high-risk patient in her late 50s.
Meantime, we also know the death toll has climbed to over 100 in this country.
We have the worst kind of breaking news. Washington Post reporting that for the first time, coronavirus deaths in this country surpassed 100 in one day, and it's 500 total.
Of those tested, over 82,000 Americans have been infected. Over 1,100 have now died.
It took from February 29th to March 17th to get to 100 deaths. It took another 9 days to get to 1,000 deaths. Sadly, it took 72 hours to get to 2,000 deaths.
The U.S. has over 240,000 confirmed cases as of today, which means that our country now has more than double the number of cases than any other country in the world has. We are getting close to 6,000 Americans dead as of this evening.
Our hearts go out to all of the families of the more than 10,000 Americans who have succumbed to the coronavirus.
We passed a grim milestone today. More than 50,000 Americans have now died from this virus, and the number is likely much higher due to insufficient testing.
The news that COVID-19 has already claimed more deaths than were lost in Vietnam. It's a very jarring reminder of where we are, because we're just at the beginning.
On a weekend traditionally devoted to honoring the wartime dead, Americans are struggling to make sense of a death toll that's climbed to nearly 100,000 over just 3 months.
200,000 Americans dead from COVID-19, each a life, each a tragedy. More Americans have died of COVID-19 than Americans perished in World War I and Vietnam combined.
Lindsay Fairchild took this photo as she said goodbye to her father from the other side of a glass window. It was a role reversal the ICU nurse never wanted.
You know, seeing my dad in that condition, I just realized like people don't get to see this.
It's the story behind each of those 300,000 deaths that make the statistics so devastating. But to give you some perspective on those numbers, the U.S. makes up just 4% of the world's population, but we account for a quarter of confirmed COVID cases and nearly a fifth of the deaths.
400,000 people dead from COVID-19 in the U.S. They were mothers, fathers, aunts, uncles, friends, co-workers, even some children. And now they're gone. It is hard to imagine this situation getting any worse. But Biden coronavirus advisor Michael Osterholm says it could.
I worry desperately in the next 6 to 12 weeks we're going to see a situation with this pandemic unlike anything we've seen yet to date. And that is really a challenge that I don't think most people realize yet.
400,000 Americans have died. That's more than have died in all of World War II. 400,000. And this is a wartime undertaking.
The coronavirus killing more than 8,200 Americans in just the past 48 hours. Putting those numbers into perspective, more deaths in the last 2 days than in the first 35 days of this pandemic. And now scientists are closely monitoring a new concern. Mutated strains of the virus from the UK, Brazil, and South Africa circulating around the world. Some of those strains here in this country. British Prime Minister Boris Johnson warning that the UK variant appears to be not only more contagious, but also more deadly. Meanwhile, another problem. At least a dozen states here in the U.S. say they are running out of COVID shots. Former FDA Commissioner Scott Gottlieb now saying it will be difficult to have most Americans vaccinated by the fall.
We're still going to have the disease next fall and winter, particularly if these new variants become the predominant variant in the United States by then, which is a real possibility. So I don't think that it's going to be, life as we knew it in 2019. I don't think we're going to get 80% of the population vaccinated, quite frankly. I think 50% is an achievable goal, and then beyond that, we're going to have to work at it.
NBC News correspondent Aaron McLaughlin's in Los Angeles with more on the vaccine supply issues and these frightening new COVID variants.
Hey, Allison, more than half the country is seeing an increase in COVID-related fatalities, and a new study shows that the risk of death doubles for overwhelmed ICUs, as scientists say they're worried that this new, more contagious UK strain is now spreading like wildfire. Across the country, the staggering COVID death toll is soaring. On Wednesday, more than 4,100 lives lost, the nation's deadliest day on record.
Once it takes hold of a person, it is a slow, energy-sapping, horrible respiratory distress, just a terrible disease to see people go through. There's no treatment. So it really, we're so reliant on this vaccine.
As the nation looks to the vaccine for relief, frustration for the newest group eligible for shots. Those 65 and older spiking demand for an already inadequate supply, while they try to navigate overwhelmed websites and face wait times of up to 8 hours in some places.
Not quite sure what's going on. It's very frustrating.
Scientists say the current pace of vaccine distribution is no match for the new, more contagious UK variant. The CDC expects it to become the more dominant strain by March.
Today, it appears that the vaccines will still be effective against them. With the caveat in mind, you want to pay close attention to it.
And some warn even more precautions are necessary to stop the virus spread.
We all need much higher quality masks in any sort of high-risk situation. If you find yourself in an indoor space, a grocery store, or in an office building around other people, a simple cloth mask is probably not enough for this very contagious variant.
This as hospitals are already pushed to the brink in states such as Arizona, where more than 100,000 of the 700,000 confirmed cases are children.
Over the past 3 months since the surge started again, we've seen a 5- to 6-fold increase in COVID hospitalizations in children. It has affected the children just as it has adults.
For higher risk activities such as going to the grocery store, experts recommend you upgrade your mask sooner rather than later. They point to KN95s, KFN94s. If you can't find those, look for surgical masks or even double up your cloth mask for that extra protection. Allison?
More than 119,000 Americans in the hospital right now with COVID-19, but hundreds of thousands of doses of a drug that could prevent hospitalizations are sitting on shelves unused. Health officials say monoclonal antibody treatments can keep COVID patients out of already overwhelmed hospitals. So why are those drugs just sitting there? NBC News correspondent Kristen Dahlgren joins me now. Kristen, I got to ask just the basic question. Why aren't they using these treatments?
Right. And you just heard about how difficult it is to get vaccines out and get enough doses. And then you hear about all of these doses of a treatment, one of the few treatments that's actually approved for COVID-19 just sitting on the shelf. And it really is confounding. A couple of things going on. One, this is really for people with mild to moderate symptoms. So to get this treatment before they actually show these more severe treatments, it has to be given in the first 10 days after a positive test. And so that's one of the difficulties. And then it has to be given in a clinical setting. So to people in an infusion, into their arm, into their vein, in a hospital type setting or in a doctor's office. And frankly, a lot of people just don't know about it. And they're being told you really need to ask for this. Ask your primary care doctor as soon as you're diagnosed, as soon as you get that positive test. And if you qualify, then you can get it.
These are the same antibody drugs, if they sound familiar to people, that former President Trump took when he got COVID. How do they specifically work, and who is eligible for them?
Right. And remember, President Trump, former President Trump at the time called it a cure. Now, doctors aren't going that far, but it's a synthetic drug. It works like your body's own antibodies against COVID-19. And so you're given it and then your body's able to fight off the virus. So who's eligible? And this is done under an FDA emergency use authorization. And so the people that are eligible are those that are at higher risk of developing a more severe reaction to COVID-19. So those that are over 65 and with underlying conditions. And again, only those with mild to moderate symptoms before they're hospitalized. And the point is that this treatment may prevent them from having to be hospitalized, which would be huge for the healthcare system that's just overwhelmed right now. Think about it. If you didn't have that many people actually having to be hospitalized with this, it would really make a huge difference in fighting the pandemic.
All right, so we know they can make a difference. We know health officials on both the federal and state levels want these antibodies to be used more widely. What do they need to do to make that happen? How do they get barriers out of the way? How do we change this from being a story about things sitting on the shelf to treatments being used?
Right. So a big part of it is awareness. If people know, if their providers know, that will make a huge difference. And then it's just the logistics. Because this has to be given in a clinical setting, you need to have these infusion centers set up. You need to be able to get it at your doctor's office, maybe. So it's just the logistics of being able to get this to people. Think about it. They're going to be COVID positive people. So it has to be done very carefully so you're not putting more people at risk. But it is just getting the logistics, getting the infusion centers set up, and getting these doses out to people, because doctors are saying, my patient needs this, I'm prescribing it, let's get it. And I talked to a patient who said within 3 days of getting this, she was running again. She felt so much better. It really helped her. I know of another doctor whose parents were positive, and she made the call to Eli Lilly herself and said, I want this for my parents. And she really thinks that she may have saved their lives. They weren't yet seeing severe symptoms. They got this. They didn't get any worse.
Wow, it could really make a difference. Well, thank you so much, Kristen, for coming on and letting our viewers know about it. Hopefully, if they know people who might need a treatment like this, they now know what to do.
Absolutely. Take care.
The European Union may cut off travel to and from the UK to try and contain that highly contagious coronavirus strain. NBC News chief foreign correspondent Richard Engel is in London with more on that plan.
Allison, I hate to say it, well, many Americans were dealing with the political turmoil, the assault on the Capitol, the transition of power, which was not until the very last minute peaceful. The rest of the world has been dealing with these horrible variants. Here in the UK, it is the only story. The UK variant, which is dominant here, which is highly contagious, has put death rates at nearly double what they were during last year's peak. This country is talking about imposing even more lockdowns, extending lockdowns even further. They're considering perhaps totally cutting off this country, banning international travel, and to a degree that is already happening, with many European countries saying they don't want travelers from the UK. It's already difficult for travelers from the UK to go to mainland Europe. And this is not the only variant. There is also the Brazilian variant, the South African variant. In fact, virologists and scientists I've spoken to aren't sure they have any idea how many variants are out there, because frankly they're not that easy to find. You need to do complex genetic testing. You need to sequence the virus. That takes expertise. It takes very expensive equipment. It takes the correct laboratories. It is not a simple swab or a blood test. So most of the world isn't sequencing, isn't checking for variants, and doesn't know what the variants circulating in potentially their own countries may be. But we are learning a little bit more about some of these variants, and what we're learning is troubling. The South African variant, which is no longer just in South Africa, according to the inventor of the scientists who discovered the variant, and a recent study, may be able to reinfect people. That is, once you catch COVID, you develop antibodies, but this variant has evolved in such a way that it can get around those antibodies and reinfect people. And the concern is, if it can get around antibodies and reinfect people, it could also be resistant to the current vaccines right now, raising a whole host of questions about, do these vaccines need to be updated? How can this be dealt with? So these variants are a massive problem, a growing problem. On a practical level, here in the UK, this variant has shut down life as we know it here and sent death tolls really through the roof. Allison.
Joining me now, Dr. Mati Schladishweyo-Davis, infectious disease physician at the Washington University School of Medicine and the John Cochrane VA Medical Center. Dr. Davis, we always love seeing you, especially on a Friday. UK Prime Minister Boris Johnson today saying something pretty scary. There is evidence that that UK variant could be deadlier. It is already here in the U.S. If this is, in fact, a more deadly strain of COVID, what do we need to do?
Well, thankfully, the new administration has already shown that they want to be aggressive about dealing with coronavirus moving forward. They want to show consistent leadership, which is what we've been looking for. They want consistent messaging, and they want to help states to get ahead of this because, quite frankly, most states have been struggling. While this may sound concerning, what we do know is that researchers at Walter Reed, at Pfizer and Moderna did do research on the UK strain, and all data thus far shows that the vaccines that are out right now from both Pfizer and Moderna are effective against this strain. So until we know more, I think it's important for the public to stay calm and continue to do what we've been asking. The vaccine being the most important tool in our toolbox, but still social distance, still wear masks, and still avoid large gatherings while washing hands.
Dr. Davis, President Biden's plan to combat the pandemic includes 100 million vaccines in 100 days. That is really ambitious. Is it achievable?
You know, it is. And I think the most important part is that it's needed. As you know, vaccine rollout at the beginning of this was woefully inadequate. We are seeing too few people take the vaccine even when it's available to them, especially in Black and Brown communities. This is something I've been talking to you about for months. We knew this was coming. We knew that there was high degrees of vaccine hesitancy within these communities. So to see an administration that has brought back science to the fore, to the lead, to see Dr. Fauci back at the helm, but to also see someone who is leading the task force in Dr. Nunes as far as equity goes is very important because we're not going to get these numbers any better if we don't do a better job of really meeting people where they are and quelling their fears around these vaccines.
Dr. Davis, we keep hearing stories of vaccination appointment issues here in New York. I've personally seen my parents who are senior citizens and will kill me for describing them as such, have their appointments canceled. It took forever to even get those appointments. I've heard stories of people showing up for appointments at hospitals in New York City and they are turned away because the shots are already gone. What is your advice for people in these situations? What should they do? And then what about people who may have gotten their first shot and are now worried they're not going to be able to get their second?
I think the most important message I can say is stay calm. Do not panic.
Yeah.
States are doing the best they can. Up till now, it has been a struggle for them to get the support they need. President Biden has told us that he is now going to apply funding and apply practical help to get states what they need. We need, I, as someone who sits on the Board of Health for my city, for example, we need to continue to apply pressure, positive pressure, as we will. However, in the meantime, the public need to do what they can. If you have a vaccine list that you can sign up for, do it. If there's a number provided to check up, do that. If you get there on the day and things are running behind, show a little grace. Everybody is doing the best they can. We are at a year now of dealing with this. And the folks that are doing this work are doing it diligently. So just continue to be patient, have hope. Vaccines are here. We will get to everyone. And even if you are delayed, just take a deep breath, get back on the list, and you will get your vaccine.
Dr. Davis reminding us all to keep calm. We will get our vaccines. Thank you so much and have a wonderful weekend.
You too, Allison. So great to see you.
I'll see you soon. If you're getting on a plane, a train, or a bus, you need to bring a mask. President Biden signing a new executive order requiring masks for interstate travel. Starting Tuesday, anyone coming into the country has to get a negative COVID test result within 3 days of their trip and then self-quarantine. NBC News foreign correspondent Molly Hunter has more from London.
Hey, Allison. Hello from a very quiet Heathrow Airport. Look, we're just off one of the main runways. Normally planes whipping by. Not a lot of planes taking off at all, and certainly not a lot of planes taking off to the U.S. So this new executive order that President Biden has signed now requires a negative PCR test 72 hours before flying and then quarantine or self-isolation upon arrival. As far as reaction here, it really only applies to the people, of course, who can fly to the U.S., like me, an American living in the U.K., because right now, British citizens, Europeans are not allowed into the U.S. at all, so can't even board flights with a negative COVID test or without. Now, the U.K. has a similar policy in place. To get into the U.K. at all from anywhere, you have to also show a negative PCR test 72 hours before, and then once you arrive, you have to quarantine for 10 days. Now, the way they've been enforcing it here, Allison, you land, you fill out something called a passenger locator form. So you provide your address, your contact information, your email, maybe your boyfriend or your sister or your roommate's contact information, something so they can track you down. The government has gotten much more rigorous at spot checking, essentially calling you, texting you, showing up at your door to make sure you're self-isolating, and then asking for that proof of a negative PCR test. And what the government is doing, if you are not following the rules, they're fining you. Big fines for breaking self-isolation. And if you can't actually furnish that negative PCR test, the fine right now is £500. That's almost $700. Allison?
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.